Welcome to the first of two programs on St. Vincent de Paul's programs of mental health. This is our first segment, and the title is Mental Health, People Recover. I'd like to introduce our panelists, if I may. I'd like to introduce Dr. Charles Dike, who is the Medical Director, Office of the Commissioner, Connecticut Department of Mental Health and Addiction Services.
Hi.
Dr. Dike is Associate Professor of Psychiatry at the Yale School of Medicine.
Thank you.
I'd like to introduce Holly Nichols, who is the Director of the Casa de Rosa Group Home, which is run by St. Vincent de Paul Mission of Waterbury.
Hi.
Dr. Cheryl Ellis, who is the Clinical Director of the Western Connecticut Mental Health Waterbury site. And Mr. Mark Cavanaugh, who's Director of Quality and Client Services for St. Vincent de Paul Mission of Waterbury. To get us started, Dr. Dike, could you tell us in general terms how mental health conditions affect people?
Thank you, Mr. Howe. Mental health conditions are very common conditions that affect people's behaviors, thinking, speech, feelings, mood. They have the ability to affect all those different areas, or they might affect just a few of them. I would like to also quickly comment on how common they are, that they are pretty common in the US and actually all over the world. The current thinking is that 1 out of approximately 5 individuals in the US has a diagnosable mental health condition as we speak at any point in time. And over a lifetime, the number rises to about 50%. So approximately half of individuals in the US over a lifetime would have had a diagnosis of of a mental health condition or the other.
So in the course of a lifetime,
Yes.
half of us will encounter some diagnosable mental health condition, and 20% at any given time have some mental health. Now, what are some of the names of some of those diagnoses that you would be speaking of?
Well, the common ones are like anxiety disorders, major depressive disorders. People generally call them depression. Some psychotic disorders, which an example is schizophrenia. There's also bipolar disorder. So these are the common types of mental illnesses that maybe we'll talk about today.
So those are some of the most common ones.
Yeah.
And this has a great social cost.
Absolutely. Mental health disorders are very expensive.
Okay.
They are expensive from a point of view of the cost to the individual who's suffering the condition. They are also expensive to the economy. They are expensive in terms of treatment. So individuals with serious mental disorders sometimes might have conditions that stop them from being able to work to their fullest capacity, or to, in fact, not be able to work at all.
Okay.
And so in the US, it's generally estimated that about $110 billion are lost per year from individuals, from lost productivity and lost income from individuals with mental health conditions.
So above the cost of treatment services,
That's correct.
$110 billion a year in the US alone is accounted for in lost productivity, lost work time, and costs to people's lives in that respect.
That is correct. The other thing I want to mention is, as a result of how the illnesses sometimes can be serious, it is also generally estimated that about most people with very serious illnesses could lose up to 10 years of their lives,
Okay.
or even up to 20 years of their lives. So they die earlier. Individuals who can die earlier than they ordinarily would.
So people with mental health, emotional addictions, conditions
Yes,
can die 10 to 20 years earlier or even more.
exactly, especially if it's very serious.
So you know what I would do is I want to move over. Dr. Ellis, now we have in the Waterbury area a public mental health system. And could you kind of give us an outline of the kind of elements of that public mental health system?
So like Dr. Dike mentioned, there are a number of aspects that are influenced by mental health. And so in Waterbury, we kind of look at it as a holistic approach. And we have a number of services available. We have really mental health programs that focus on the severe and persistent mental illness. We have substance abuse programs. We have what we call support programs in the community that will assist people with some supports in the community as well. We also take into account medical. We also take into account that we have individuals who need some employment, so we have supported employment programs as well. We also have residential programs that provide some additional supports in the community. And a lot of individuals are kind of well-rounded and need all those things to help support them in their recovery.
So in the public mental health system that you're describing, which is people that are either under the who are not necessarily getting private insurance or private care. In the public system, there's services for addictions, for mental health, for vocation, because people to rather regain some of their lives that have been lost. And actually, if I can jump back to Dr. DK, the cost is, I've read recently the World Health Organization that among the top 10 expensive diseases in the world, mental health conditions of depression and some of the others are actually among the top 10 most expensive services costs in the world in healthcare.
Absolutely, that is very correct. And I think it's actually rising. Because as we begin to handle cardiovascular diseases, musculoskeletal diseases, because of attention that's been paid to those diseases in the past, the mental health conditions begin to rise to the top. And depression now is really high up there. And if you add substance use, which is also mental health, I didn't mention that initially, and you add things like dementias, and the population is aging, so you can imagine how mental health conditions can take over completely in terms of cost and expense.
And Dr. DK, you say an important thing, that as we address coronary disease, as we address cancer more effectively, and fail to address in some ways depression, anxiety disorders, and addictions, those rise to the top as the others are reduced.
That is correct.
Wow, okay, thank you. But we're talking about St. Vincent de Paul services, that the St. Vincent de Paul mission of Waterbury has a variety of mental health systems. Holly Nichols, could you comment on describe maybe what the Casa de Rosa system is?
Sure. Casa is an 8-bed group home. We're an active rehab program. We expect people to participate in this program, and it's to help them move towards their recovery. The length of stay is usually 6 months to 2 years. We are all about recovery-oriented services. It's all about the clients themselves, the people themselves, and we use a lot of person-centered language.
Okay, so in a group home setting, so this is a group home setting for eight individual, 8 men.
Correct.
8 men at this point.
Right.
And the programs that they participate in are helping them to
move towards their recovery and transition out to a less restrictive setting.
So this is a very full-time kind of setting.
Yes, it is. It is 24 hours a day, 7 days a week. There's staff, and they are expected to work for participate in 10 hours a week programming.
Okay, so that it's for people that have gotten that have come out of actually Dr. Ellis's system.
Correct.
Of people that have needed extensive services.
All referrals come from Western Connecticut Mental Health Network.
Okay. So the more intensive system that is St. Vincent de Paul Mission offers is Casa de Rosa Group Home. Mark Cavanaugh, could you give us a description of the Cornerstone program?
Well, Cornerstone is a less restrictive setting from our Casa de Rosa Group Home, and it's able to help 18 different individuals living in an apartment setting together. And those 18 apartments are actually mixed together with apartments that we rent to the general public. Okay. So it's really designed to get folks ready to be living independently in the community. We work with folks on adult daily living skills, from hygiene to budgeting, taking care of their medications, getting to their appointments, speaking with their doctors, and really provide a setting for them so that we become dispensable, that one day they could do these things independently on their own. And that's our ultimate goal, to work with folks. And people tend to live up to high expectations, and we try to do that with our folks.
Okay, so actually what you're pointing out, another item I think is important, so that in the idea that our apartment program is organized so that people will get support in the systems that are preventing them from living on their own, living in a more ordinary life. Those services are supported through St. Vincent de Paul, but you're also saying high expectations. Mental health has a lot of stigma associated to it. So that is, I guess what's making me think is there's often low expectations toward people that have a particularly severe and prolonged mental health. I wonder if we've got a moment to address, sort of the question of what does the word stigma mean relative to mental health and addiction services?
To me, it means that people don't know enough about the illness, and they make their own assumption about what that means, and it's placing a label on somebody. And these are individuals that are experiencing illness. They're not their illness. And there's no reason why the folks that we work with don't move on to get their own job, to get married, have children, and live a sustainable life in the community. It's not their illnesses that's going to hinder them from doing that. We help them see that.
Okay.
If I may add to the stigma, I think one of the things I find is that people often say that individuals in mental illness, there's something wrong with their moral core. Either there's something, something about it, so it depends on where you're coming from. Right. Something is due to morality, something you're just weak. You should pull yourself up by your bootstraps and move on and do. And so the mere idea that you have a mental health problem means that there's something already wrong in your system. Either you're a sinful human being, or you're a weak human being, or there's something that is very shameful that you have done. And so people are afraid to come out because of that kind of labeling. And that's what I would consider the stigma coming from.
So stigma associated with mental health is some of these ideas that are really from the past of weakness,
yes,
sinfulness. Somehow
yeah,
my mental health is a punishment,
yes,
for sort of some misbehavior of my past.
And part of it is if you have physical health problems, people can see it. If you have a broken bone, it's very clear to everyone. If you have fever, everyone knows that. But if you have a mental illness, another disease, except this time is in a brain that is enclosed by your skull, and nobody can see it.
Okay.
And so what they see is these abnormal behaviors. Everyone recognizes the behavior, but it's excessive, and so there's something wrong with you.
Okay. So that is the attitude. Is there more to add to that, Dr. Ellis, Holly?
Well, I agree with both what Dr. DK and Mark have already said in terms of sometimes people come with preconceived notions of what this person is. And part of the stigma is you've created an image where that is the person, not seeing it as something the person's experiencing. So when someone has like a medical illness like cancer, we don't say the person is cancer, we say the person has cancer. And I think that, just the way we think about mental illness is part of the reason the stigma kind of carries on.
The person is not the diagnosis.
Correct.
So a person is not their diagnosis. So you could be a person with diabetes, but
yes,
you're not diabetes. You
correct,
could be a person with cancer,
but you're not cancer.
But when I think public information will say a schizophrenic, but it's a person.
It's a person
with schizophrenia. So that's part of the attitude of person first language, and
yes,
and as Dr. Ellis had said, the sort of the holistic approach toward mental health. I want to move on to it, sort of going from this. The idea that people have about mental illnesses, and I if I may use, like schizophrenic illness, which is 3 million Americans have schizophrenic illness. The idea that there's the dramatic symptoms, but there's also other symptoms that are involved. Dr. DK, could you talk about that?
Yes. We have divided the types of symptoms you have with schizophrenia or other types of psychotic disorder, which in global terms just means that someone has an illness that makes it hard for them to recognize reality or to lose contact with reality. So they've divided them broadly into what we call positive symptoms and what we call negative symptoms, so that the positive symptoms are the ones that people quickly recognize. For example, someone who has what we call hallucinations, which means that you either can hear voices when you're alone by yourself, or you can see things that nobody else can see but you, or those people who have what we call delusions, which are false beliefs that are held really tightly despite contrary evidence. And people around your social context, your economic context, religious, they don't share the same beliefs that you present.
So a delusional belief is a mistaken belief that a person, so an example, maybe a paranoid belief
Yes,
that
so-
people are against me or want to harm me, but nobody else could recognize that as being true?
Yes, nobody else in their family, in the church, in any of their circles would see those things as true. But this individual will hold them very tightly and firmly, even when you show them evidence to the contrary.
Okay.
So that's a delusion. So those are positive symptoms. Sometimes it's disorganized thinking, like people speak and you can't really understand what they've said because the thoughts come out jumbled up some way and you can't make sense of it. These are positive symptoms.
Okay.
But there are also negative symptoms where the individual doesn't show any of those signs. Instead, everything seems to have slowed down. So you have slowness of thinking, you have slowness of speech, you have no motivation, you have no drive whatsoever. You have, even emotions, they can't show emotions because it's flat. You can't see them when they're happy or sad. Most people will smile when you're happy or sad, your face. But when you have negative symptoms, your emotions are rather flat.
So when you say flat, that means I don't express.
Not
my
expression.
face
more or
wouldn't
less.
express any whether I was angry or frightened or happy, or it would be
Exactly.
very little expression.
Very little expression, just down, and that's correct. And those are the negative symptoms. And people, can sit at a spot for a long time, not willing to do anything, not motivated to do anything, have no attention. In the attention span is less than normal. And so you add all that together is what we mean by negative symptoms.
So those sound like they could interfere with your life dramatically.
Definitely, they affect your ability to function in every way.
What I want to do is I want to do two things. On the one hand, I want to hear more about other kind of mental health conditions, major depression, bipolar illness, things that people have heard of.
Yeah.
But also about how do you address some of this side that Dr. DK is describing with the negative symptoms of not feeling, not having pleasure, not having much thinking sometimes. Let's hear for a minute about how do you address that in the programs when a person has these negative. We'll come back to the depression, but how do you address that when a person has these negative symptoms? Either Mark or Holly.
Well, in our supervised apartment program and in our group home, we try to activate folks. We want to get folks together. Something as simple as playing a card game or a Jenga game can really begin to get folks to learn how to interact in a healthy way. We've started various groups, like a Place of My Own group, where we're trying to transition folks into their own community, but getting them together and sort of talking together about how that could take place. We've noticed that folks are not isolating as much. They're coming out. They're often they have difficulty thinking that this event that we're going to do is going to be joyful. So we're putting up pictures of them having fun together so they know when we go to the ballpark, we'll have a good time. And it's really had a profound impact on folks' life. And we get their family involved as well.
So the impact of some of these symptoms where people don't have feelings, don't have activity, don't feel like they're motivated, can be really devastating.
Oh, absolutely.
And it's not the same as laziness.
Oh, it's far from
It's
laziness.
far from laziness.
It's far from laziness.
Yes. In the group home, we have two main groups. That we have a focus group where we start our day, and it really helps everyone to get together, talk about what their appointments are, if they have to go someplace, how they're going to get there. And then at the end of the day, we do a wrap up. How did it go? Did you participate? Were you able to make it on time? And it really, really helps bring us all together. We discuss it. They're not isolated. They're not, well, I didn't make it. It was a bad thing. We're able to discuss it. And they have their peers with them as well. So they can, oh, you did a good job. You made it.
So people can get supported. That's what you mean by support?
Yes.
Is that people get a lot of positive reflection on
Yeah.
things that they're doing well, and maybe freeing themselves from these really sound very debilitating
Yes.
symptoms.
Yeah.
Between Dr. Ellis and Dr. DK, could we talk about, I guess I want to hear about the bipolar illness and the major depression, which I know are also conditions that have severe impact on people.
Do you want me to take bipolar?
Go for it,
Then you
Dr.
can take. Okay, so as the word bipolar means two poles. I mean, I think that's just the first place to start. It means that an individual's moods can fluctuate between two poles. One is the mania, which is the highs,
Okay.
and one is the depression, which are the lows. And then in the middle is what is your normal mood. So, and I think people just understanding that that's what that means to start off is important. And what mania means is, it starts with the type of mood state. You're feeling euphoric, like extremely happy. And again, why this is different and why this is a problem is it's not just your normal happiness when something good happens to you.
Mm-hmm.
It's extreme happiness to the point where even you know something is wrong.
Okay.
See, the people actually know that this happiness is not normal, it's euphoric. And in addition to that, you have excess energy. So you also know that this energy is beyond your normal type of, you feel invincible, like you can fly. And then other things begin to happen to your thinking. Your thinking is really speeded up. And the way people know your thoughts are fast is from how you speak. So your voice and your speech becomes really, really fast. And the way we describe it in terms of your thinking speeding up is how cars fly on the highway, how fast cars are flying. That's how the thoughts will be flying inside of the individual who has this.
So a person with bipolar illness, which is also many millions of Americans.
That is correct.
There's 5 or 6 million
Very
Americans
common.
that have bipolar illness.
That's correct.
And different degrees of bipolar illness.
correct.
Some people are extremely productive and don't have the terrible consequences, but when, as you described, the mania, somehow their goals and hopes break down.
Yeah, so what tends to happen with that, I'm glad you brought that up, is two things happen. First, people in that condition don't need much sleep.
Mm-hmm.
So you sleep 3 hours instead of your usual 8,
Okay.
and you wake up full of energy. And you can imagine how long your system can handle that. When your system needs you to sleep more than you're sleeping. So ultimately, it's going to break down at some point because you're running, it's like an engine that is running very, very fast. The other thing is because you have too many ideas in your head all at once, you're running around doing different things all at once. And at some point, you're not going to be able to accomplish all of them because you start off something and you quickly move to the other and you quickly move to the other and nothing is accomplished at the end of the day.
So a person can become very
Can
scattered.
become very scattered and ultimately unproductive. The mild forms are the ones that are, I think we need to talk a little bit about them because people like them. You're more productive initially, you can stay up for a long time and you can do so many things, ideas are flowing, so you can be productive initially. The problem with that is again back to the speeded engine story. If at some point in time you're not able to slow down, you're going to run yourself also down and ultimately get into significant difficulties with your health.
Okay. So there's different degrees of the high side of bipolar illness. So
That's
the
correct.
mania side.
Yes.
Some don't interfere terribly with life and make you more productive, but they can ultimately lead to a breakdown.
Absolutely.
And exhaustion.
That's correct.
Maybe if can we go to Dr. Ellis on sort of what, because major depression and the depressed side of bipolar illness, are those similar? Are they different?
They're very similar. And what you'll find is individuals become very lethargic. They have very little motivation. They may even sleep for long periods of time. And family members may see that as just being lazy. And what happens is the person may not understand why they're feeling this way, why the mood state that they're in has them unable to do things, and that may lead to further depression because they feel like they're not being productive, they're not able to do the things they think they should be doing. The other concern with major depression is sometimes people get a sense of hopelessness and helplessness, and sometimes may have thoughts of harming themselves because they just feel like they can't get out of the state. So those are, a lot of the things that people don't really pay attention to, because the person may go off and be quiet and not say much.
Okay.
And so you may not know that someone is extremely depressed until you ask a question.
So sort of summarizing that is that the psychotic illnesses, schizophrenic illness, bipolar illness, are really people separating from reality in some way that other people would understand.
Yes, right.
The moods and associated with bipolar illness and major depression, but are these all treatable? Can people get better? Do people recover? I mean, I've heard from Mark and Holly that people turn around and recover.
Yes.
I would say that, and I think emphatically, I want to say that very firmly, that people recover, people get better, people recover, people lead useful and productive lives.
So people can recover. That gosh, the time is running. I want to. I guess I have to move us along. We could go on for another hour, I think. Getting services. I know 211 is one place. Family
Yes.
doctors, personal physicians are a great way to start.
Yes.
If people get connected to services, and people do recover. I want to take a minute to say that if this has been put on by the St. Vincent de Paul Mission of Waterbury with our guests helping us, and how can you help the St. Vincent de Paul Mission? You can go to the St. Vincent de Paul Mission of Waterbury website to support it. Please like us on social media so that you can give the updates and the information. Individuals or organizations can sponsor donation drives. The mission also has lists of items that the mission can use, bus passes, gift cards, clothing. And individuals or organizations can volunteer any variety of skills, painting, but also things like quality of life skills like literacy, art, yoga. I want to thank Dr. Charles D.K., Medical Director for the State of Connecticut Department of Mental Health, Holly Nichols, Director of the Casa de Rosa Group Home, Dr. Cheryl Ellis, who is the Clinical Director for the Waterbury Area Mental Health System, and Mark Kavanaugh, who is Director of Quality and Client Services for St. Vincent de Paul Mission.
Thank you for having us, David.
Thank you
Thank
very
you.
much.
Thank you.
Thank you very much.